Dear Chair, dear audience, welcome to my 9-month progress report. My PhD thesis is New Approaches in the Management of Oncological Patients. I am Renáta Árok, and I am a hospital and clinical pharmacist and a first-year PhD student as well. My vision is that oncological patients could have a better quality of life. Therefore, my mission is to find the most effective and appropriate treatment and management of side effects in oncological patients. Currently, I have two ongoing projects, which would be a systematic review and a meta-analysis. My first project is investigating the efficacy of preventive and therapeutic options for kinase inhibitory therapy-induced skin toxicity. Let's talk a few words about the background. There has been a tremendous shift in cancer treatment for the last 2 decades. Taking the data into consideration, we would say that oncology indication approvals has increased in this time, driven by targeted drugs. Moreover, a number of these agents were in the top-selling cancer drugs in 2022. As you can see in the figure, kinase inhibitors had the highest number of approvals compared to all other classes. So we can see that their use is continuously rising. But unfortunately, they have the highest rate of occurrences of serious side effects as well. These side effects threaten the original cancer treatment. Therefore, the discontinuation of cancer treatment by the patient occurs up to 76%. Interestingly enough, there are numerous prevention and treatment options in healthcare, but no consensus. So my aim is to find the most effective and preventive and therapeutic options for kinase inhibitory therapy-induced skin toxicity. My clinical question is the same as my aim, and using the PICO framework, I investigated the prevention and treatment options compared to no prevention, no treatment, or placebo, measuring the outcomes with efficacy and compliance. We hypothesized that implementing of prevention and treatment options result in higher compliance to the original oncological therapies. I conducted a systematic search at the end of last year, and here you can see my search key and my flowchart of selection as well. The number of the articles I found was overwhelmed, and eventually I have 63 eligible articles. The outcome was incidence of prevention and treatment, and mainly I have finished the analysis. However, I have some ongoing subgroup analysis as well. Before I move on to the results, I would like to mention a few words about how heterogeneous was my topic. The articles investigated a wide variety of active ingredients, as you can see in this slide, and many types of side effects as well. So we clinically grouped these side effects, and according to this, we evaluated our results. In the first figure, we were analyzing the incidence of skin toxicity using prevention, and this figure summarizes the randomized controlled trials in which several systemic and topical interventions were investigated. The measure of effects was odds ratio, and we found the occurrences of skin side effects decreased by 30 to 70% when the patient received any kind of intervention. Our result was not statistically significant. However, there were articles that have significant results, So that's why we want to conduct subgroup analysis as well. In the second figure, we were analyzing the same outcome using treatments in one-arm studies. There are three groups of side effects in which we had accessible results. Our measure of effects was proportion, and we found quite a few side effects. So we suspect that there is a tendency for interventions to reduce skin toxicities. I would like to emphasize some strengths that this meta-analysis will be the first comprehensive meta-analysis. I have mainly randomized control studies. The articles have high patient numbers and a wide range of investigated agents. As for limitation, I would say that there are various study designs, heterogeneous interventions, and unfortunately, the definition of skin toxicities were not uniformed. In conclusion, I would say that skin toxicity may be decreased by preventive medications, and therefore we would improve quality life of patients, interprofessional collaboration as well, and with these we can avoid discontinuation of the original oncological therapy. However, more RCRTs with unified study methodology is needed. So here you can see my progress of my first project. And let me move on to my second project, which is comparing the efficacy and safety of pharmacological therapies for advanced cutaneous squamous cell carcinoma. Cutaneous squamous cell carcinoma is the second most common tumor among non-melanoma skin cancers. Its incidence is 1.8 million per year, which is predicted to increase by 50% by 2030. It is considered advanced when it has spread or it can't be cured by surgery or radiotherapy. The cutaneous squamous cell carcinoma, treating cutaneous squamous cell carcinoma is a challenge because of the poor condition of patients. Current therapies are chemotherapy, targeted therapy, and immunotherapy. And immunotherapy would be the best choice because of the high mutagenic feature of this condition. So my aim is to find the most effective and tolerable therapeutic option for cutaneous squamous cell carcinoma. My clinical question is the same as my aim, and I will measure the immunotherapy compared to chemotherapy and targeted therapies, and measure the outcomes of survival, recurrence rate, and adverse events. Our hypothesis is that immunotherapy is superior to chemotherapy and targeted therapy in this condition. And my clinical implication is the early use of immunotherapeutic agents can improve patient survival. Here is my progress of my second project. And as a summary, I would mention that I have two ongoing projects, and I hope they will be submitted in this year. Thank you for your attention. With the words of Eleanor Roosevelt, you must do the things you think you cannot do.
Thank you for your wonderful presentation. I have a question regarding your first topic. Which therapy would you suggest for prevention based on your current result?
According to my results, so I have mentioned that I have articles which have statistically significant results. And these articles mainly investigated systemic interventions and antibiotic interventions. So I suggest that antibiotics will be the best choice. And yeah, and I hope that the results will show this.
What kind of antibiotics?
The articles investigated tetracyclines.
Thank you.
You had quite a huge amount of articles in the selection process in the first stage, and I would like to ask that what types of studies did you investigate?
Thank you for your question. I have RCTs and prospective and retrospective cohort studies in this selection. Yeah, it's surprised me that I have huge amount of articles.
And thank you for the answer. And my other question would be that how did these articles measure incidence?
Thank you. The incidence were measured the occurrences of skin side effects of so-called any grade skin toxicity, because there is a scale that phrase groups according to the grades, and if side effects occur, the articles called it any grade skin toxicity because it signed that it occurred. Yeah.